Can you please repeat the question?
The Nigerian Cancer Society, we're talking about, we started off with awareness, how much it is needed at the moment. How much is the Nigerian Cancer Society contributing in this respect?
Well, thank you very much. Good morning.
Good morning.
And good morning, viewers. And thank you very much, AIT, for having us on this program today. Sincere gratitude to Common Cancer Foundation for this platform. And as rightly stated by Dr. Denise Ejoh, that awareness is the ingredient that drives this process of cancer prevention and control in Nigeria. Because awareness is what will give us early detection, is what will make us prevent cancer. And this is the reason why the Nigerian Cancer Society and all its partner organizations are so key on awareness creation, because if you can prevent, you have gone a long way in preventing a lot of cancers. Yeah, and you know, in medicine there is this popular saying that prevention is better and cheaper than cure. Hence, it is the interest of the Nigerian Cancer Society to keep on rallying stakeholders, you know, particularly those non-governmental organizations that are working at the level of the grassroots, you know, to continue to amplify the voice of awareness, to continue to educate the populace on the necessary steps to be taken in order to prevent not only cancer, but of course other forms of diseases. And that is the rationality where in the Nigerian Cancer Society we attach so much significance to the prevention aspect, which is the awareness component. So awareness creation is key and very cardinal to what we do in the Nigerian cancer space, and we will continue to amplify our voices so that we can reach every nook and cranny of the country.
Dr. Umar, radiotherapy machines are very critical in screening and dealing with issues of cancer. Can you tell us, how many do we have in Nigeria at the moment?
Well, to be realistic, you know, we cannot say we are nowhere, because we are surely not where we are. But the optimism in us advocates is what is keeping us in the driving seat as far as engagement of policymakers is concerned. Nigeria, with a estimated population of over 200 million, needs not only, in fact, more than 200 radiotherapy machines, if not more. But it is unfortunate, you know, at this juncture, we are still talking about maybe only 6 functional radiotherapy machines that is owned by the federal government, that is primarily responsible for providing care to our teeming cancer patients. And, you know, it is again unfortunate that most of the times, you know, these machines are down. You have one part missing or the other. You have the machine in some places, and training is what is required. Well, to be sincere, we can categorically say that we are making some form of progress, because with the coming on board of you know, some state-of-the-art, you know, private cancer treatment facilities, particularly in places like Lagos and Abuja, we are hopeful that the private sector will key in and make available a lot of these radiotherapy machines, so that patients, for example, in faraway Yobe, where I am at the moment, may not have to travel all the way to Abuja. A particular patient was telling me that it is not the referral to Abuja that is the problem. It is how to even enter Abuja. Because the patient is over 40 years but has never smelled, you know, the vicinity of Abuja, and you are asking that patient now to go there for treatment. So his concerns was, how do I even start? How do I even get the transport money? How do I get to accommodate myself when I'm in Abuja? Because they said Abuja is a very expensive city. So truly, government needs to make, you know, these machines available all over the country, so that it can easily be accessible, you know, to patients. There is an initiative of the founder of BUA, where he donated some large chunk of money to Kwara State to build a standard cancer treatment center that may not only benefit those in Kwara, but of course Nigerians and indeed the West African region. And you know, we need philanthropists like that to come into the picture, so that we can have, you know, an array of these sophisticated machines all all over the country and trained personnel, to manage them. Yes, Kano state government is building an internationally standard cancer treatment center, but the issue is, as usual with the Nigerian politician, you have project that is ongoing for years, without any end in sight. And so if other states can emulate states like Kano, states like Kebbi State that have institutionalized, cancer care access for patients, it will go a long way in alleviating the sufferings of these patients. Because the reality is, cancer victims are suffering, and cancer is a disease that can affect anyone. And in Nigeria, judging by our level of poverty, level of illiteracy, and what have you, a majority, if not all, cancer victims needs help, and they need government to do the needful to provide these machines, and so that they can access care. I'm happy the machines that government has now are up and doing. And the National Hospital Abuja also has a public-private partnership arrangement, and so also is the University of Enugu Teaching Hospital. And this is the kind of arrangement we want, even though the cost of care may be expensive. But at least availability of the machines is very key and cardinal.
Yes,
to help patients access care when they need it. And don't forget, radiotherapy is just a component of the damage of treatment for cancer. So it's not only that patient will go and undergo radiotherapy, and that is that. Usually you have patients being referred to Abuja from, for example, Yobe, to go and do radiotherapy, spend a large chunk of money, and still come back, for subsequent treatment, surgeries, chemotherapy, and a lot of other things. So government really needs to do much. Government needs to increase the health budget. It is unfortunate that we are still operating, at a very negligible percentage of budget allocation to healthcare. Even this 2022 budget is still less than 5%, in direct violation of the 15% as agreed by all African Union countries to commit 15% of their consolidated budget.
Based on the Abuja declaration,
between 4 and 5%. It's quite dismal, and it may not take us anywhere. So government needs to do the needful to increase budget funding and to particularly pay more attention to the healthcare system, and of course to remove all bureaucracies associated with importation of medical equipment, associated with establishment of private facilities and what have you.
Still staying with you, Dr. Umar, because I know that Dr. Ejoh has one or two questions, but you talked about government, you talked about, calling government to question and also doing the needful, and so I'll take you up from there to, do a follow-up on that. I know you remember the just concluded International Cancer Week, which was organized by the Federal Ministry of Health here in the FCT Abuja, and there was a notable presence of the Nigerian Cancer, Society as well. Talking about that, is there any interface between the NCS and the Federal Ministry of Health with that regards, especially in ensuring funding for cancer care and accessibility to good quality cancer care? Is there any interface at all?
Well, thank you very much. Even though the network on my side is breaking when you are talking about the International Cancer Week, but I want to bring it to the attention of viewers that the Nigerian Cancer Society has been undergoing some form of rebranding, and the rebranding process is actually gaining so much momentum. Talking about the International Cancer Week that just held in Abuja recently, it was a full-packed week where you have cancer stakeholders from all over the country, not only all over the country, from all over the globe, because there was a virtual component. It was a hybrid event. And the Nigerian Cancer Society has been part and parcel of the week right from the beginning. We were deeply involved in the Central Organizing Committee, and in fact, the Federal Ministry of Health, through the National Cancer Control Desk Office of the Ministry, has carried along the Nigerian Cancer Society in the coordination and execution of the International Cancer Week. It has come and gone. we are already gearing towards 2022 edition, where we hope to have a more robust, engagement, bringing all cancer advocates, cancer specialists from all over the world. The week was actually a kind of a co-joint event with the Federal Ministry of Health. But going forward, because the Nigerian Cancer Society, being the umbrella body of all cancer-related non-governmental organizations in Nigeria and in the diaspora, it is the intention of the ministry that this week should be handed over completely to the Nigerian Cancer Society, so that the ministry will be observing and coordinating and supporting from behind the scene. Yes, funding was a challenge, but we thank God to the sponsors of the International Cancer Week. They didn't fail us, because it was truly a week to remember. And the theme for this year was cancer care for all, through strategic advocacy and investment. As key as that theme sound, the issue is all about providing care to those that have cancer. The keynote speaker at that event was His Excellency, the Executive Governor of Kebbi State, Senator Atiku Abubakar Bagudu, and this is he's a man that actually stands tall amongst his peers for doing very wonderfully well, for bringing an institutionalized system that will afford care to cancer patients, even when he's out of the government house in Kebbi State. And this is the kind of situation we want. We don't just want noises. We want a system that will last a generation. And truly, the executive secretary of the National Health Insurance Scheme, because we are talking about cancer care, we are of course talking about universal health coverage. He was there to give us an insight as to how to achieve the desired energy in achieving universal health coverage. It was a full-packed event, absolutely, like I said. And going forward, 2022 is already around the corner, because we have already started planning. And by the grace of God, with the support of the ministry, with a more robust support from sponsors, we are definitely going to break another milestone next year.
Thank you so much, Dr. Umar. I mean, quite a truckload of information there. Very insightful, vivid, and very offers a lot of clarity.
I didn't get that.
Let's come to Dr. Ejoh. Doctor, do you have any questions? I mean, he's given us so much insight already, and it's quite interesting.
Sorry,
or maybe
we can't get you.
Yeah, Dr. Ejoh, can you hear us?
Dr. Ejoh, can you hear me?
Okay, appears the network is fluctuating at the moment because we don't even see it on the screen. So we'll hopefully try to reconnect with them. I guess they're who join us, professionals. Can they hear us now?
Dr. Ejoh. Okay, I was just coming to her to, further, ask.
We can't hear
questions. You. Can you hear us now? We can hear you. Can you hear us? Oh dear.
All right. A key among the issues mentioned by Dr. Umar is the need for funding. I mean, abysmally low 6 functional radiotherapy machines in Nigeria, and he talked about the fact that most of these are even in private hospitals.
Absolutely.
I mean, considering how expensive the cost of care and treatment for cancer is, and how private hospitals are naturally expensive because they are there to make profit, is not necessarily a public service like it would be in government or public-run hospital.
Absolutely.
So it raises a whole lot of questions about government
systems.
investment in health. We talk about this over and over again, but I continue to say the fact that you run a system where public officials and government appointees, politicians
travel
abroad to seek medical care, where everything is provided. They do not have any sense of compulsion to provide these things locally, so that indigent members of the population locally can access care. I mean, he talked about the example of somebody coming from Yobe to Abuja to seek care. Okay, let's even talk about the one in Abuja. It's even a public-private partnership for the one in Abuja. Okay, Dr. Ejoh, you can hear us now.
Everything that is going on, and one of the things for a cancer patient survivor, I hear you. I think we all hear you, but we need to know how to access. Because looking at all of this, it's all well and good to have all the plans and everything. Firstly, one question: do you have a database that the NGOs across Nigeria can feed into, and they're primed into spaces where we can see who is doing what? Because for Common Cancer Foundation, we are fundamentally an awareness organization, which you know, and everything we do is about awareness. And not because we don't do other things, but that is primarily our vision. Now, if we had a breakdown, or do we have a breakdown? So every organization we have will be listed somewhere where if you were in Yobe State and there was a cancer and breast cancer need, there could be somebody to access there for support. Because no matter what you say, cancer care is one of, if not the most expensive bill. And it's very heartbreaking to not know what to do once you're in that position.
Well, yes, thank you very much. You see, the Nigerian Cancer Society that was established
All right, it appears the network is fluctuating again at the end of Dr. Umar, who is joining us from Yobe. We await his response, but let's just rehash a bit some of the things he said, which I was caught in thought there about the possibility of somebody coming all the way from the northeast state of Yobe to Abuja by road to access care. And even the center in Abuja is a public-private partnership. That means the government itself doesn't have something that is exclusive to itself. It's a public-private partnership. I suppose what that means is that probably the machine is being run or owned by a private organization, where a hospital, where the National Hospital, for instance, I think that's where it is, because there's a cancer center there, partners with. More needs to be done. It leaves so much to be desired. He talked about the promise of investing more in health. Remember the Abuja Declaration some years back, where the governments and nation states from Africa committed to investing more in health. Many years down the line, that has not been done. Appears we're having them back online now. Dr. Umar, is your network okay now? Can you respond to the pose I put forward by Dr. Ejoh?
Yes, please. No, this is Nigeria.
Absolutely. Please go ahead.
You cannot.
Dr. Umar, please, can you give us the answers to those questions, please?
Yes. So like I was saying, we have this, situation whereby non-governmental organizations are working independently and are working, in the various areas. You discover that in a particular state, you will have 2, 3, 4 non-governmental organizations working, for example, around breast cancer, and without synergy in what they do. So the rebranding process of the Nigerian Cancer Society that is ongoing has the support of most, if not all, of these non-governmental organizations. And in fact, I am happy to say here that the kind of support, the kind of encouragement and goodwill coming from non-governmental organizations established outside the shores of Nigeria, but with very strong linkage and very strong connection to the grassroots here at home. Like, for example, Common Cancer Foundation. The founder is in faraway UK, but it's as if she is here with us in Nigeria. And there are a lot of others, that have been doing wonderfully well, carrying out screenings for various forms of cancer and offering, interventions here at home. And this is a very good development for us, because we have their support, we have their encouragement, and I'm happy to inform viewers that the Nigerian Cancer Society is open to everybody. It's not only for doctors, it's not only for nurses, it's for everybody, including the politicians, because it is the umbrella body of all cancer advocates. For anybody that has the intention, the desire to see a Nigeria that is free of cancer, a world that is free of cancer, is welcome to join the Nigerian Cancer Society. So in our drive, in our drive last year, when I became the president of the Nigerian Cancer Society, we introduced a system whereby there is a Google form that every organization and every individual member of the society will register, enter his or her details and the details of the organization, so that can form the basis upon which we will now reactivate the database that has been dormant for quite some time. And again, this is another scenario whereby the non-governmental organizations have agreed, to come together so that we can harmonize on what we do. As I'm talking here today, there is a plan in motion for over 50 non-governmental organizations that are currently on the CEO's database of the Nigerian Cancer Society to bring their calendar for the year 2022 so that we can look at it and make adjustments so that it will suit us more. So that if I have a cancer organization in Yobe and want to carry out a particular campaign in a particular week, and another cancer organization in Bauchi or Gombe, for example, wants to carry a similar event around the same week, we will harmonize it in such a way that mine will be maybe the first week and yours maybe the third week, so that we can have the leverage to attend, both programs to add honor to it, So sincerely speaking, there is a database collating the names of individuals and organizations working around cancer in Nigeria, and of course, like I said, our strong affiliations in the diaspora, So going forward, we intend to solidify on this and make sure that everybody is well captured. Journalists are not also exempted. We have a lot of them. The two sitting in the studio in Abuja this moment,
hear that.
Dr. Umar, thank you so much. Of course, it's a collaborative effort. We have to go now, but let's quickly have Dr. Ejoh's thoughts as we sign off.
I've got one more question, if that's okay.
I'm not sure we'll have time to take that, so I don't know if you have any personal contribution you want to make before we sign off. Okay, yes, please go ahead.
Okay,
go ahead.
It was mainly I wanted Dr. Adamu to tell us in one word what he wanted his legacy to look like. But Commonwealth Cancer Foundation continues to work with AIT and National Cancer, so we'd like to say a very big thank you. And you can always watch whatever is going on. You can follow the spaces. A lot of the things that are going on in the cancer space are in. You can find it on the National Cancer site as well, society site. I think we all know where we are. But Dr. Umar, thank you very much, and please tell us what you intend to do. One word, please, to finish up this segment. What do you want us to remember you with?
Well, talking about a legacy that I would want to be remembered for, I just finished talking about the array of support and coordination we are getting from our partner organizations. But most importantly, I would want a legacy that will last a generation. The Cancer Health Fund that we are about to start implementing, there has been so much noise about it. For 2 years, government has been budgeting money, but implementation is still yet to start. But we are pushing and we are making sure that implementation starts so that indigent cancer patients can benefit. So currently we have 1 billion naira for the 2 years, and I think about 600 million naira has been allocated according to the legislatures in this year's budget. And it is our prayer that instead of going down, that 600 million naira will also be increased to 1 billion naira. So as a legacy, I want to be remembered as an advocate that has brought energy to the Nigerian Cancer Society to the extent that government will be budgeting 6, 7 or 10 billion naira annually in the Cancer Health Fund so that indigent cancer patients can benefit, because cancer affects everyone. When you have one person in a family that has cancer, it affects the whole family, it affects the whole society, and of course it affects the whole nation. And there is no...
All right, thank you so much, Dr. Denise Ejoh there from Commando Foundation, and Dr. Umaru from Yobe reaching us live from Sweden. Thank you so much. You've been fantastic, the both of you. And he says he wants to leave a legacy for generations to come, and I think that is quite insightful.
It's a challenge, and we hope he is able to push through that challenge with the support of course, Dr. Ejoh there. Thank you so much. Adamu Al-Hassan Umar is a doctor and the president CEO of the Nigerian Cancer Society. Joined us all the way from Yobe, Northeast Nigeria. And Dr. Denise Ejoh joined us from London. She is the founder, Commode Cancer Foundation. Thank you so much for your initiative.
Thank you.
Thank you.
Thank you.
Bye.
Bye-bye.